So our abstract category deals with the pharmacokinetics and pharmacodynamics of drugs. And what was really nice to see was how these concepts are now being implemented. It's not only a research category anymore, it's really a category that is showing implementation of these techniques. So that means how are pharmacokinetic, pharmacodynamic principles already used in drug developments. We have seen many submissions for new antibiotics, and we see how these techniques are applied to early on try to come up with optimal dosing strategies. That's in the early phase, and then in the later phase also in the application of the drugs in the clinical setting, that these concepts are really applied to derive dosing suggestions for special patient populations such as critically ill patients, pediatric patients, or also patients on organ support, which are really difficult to dose, where these concepts can help to derive dosing suggestions. A lot of studies on therapeutic drug monitoring in critically ill patients. We had a lot of abstracts there, and this is really important work. It's related to the question before, because these patients, we do not know what happens with the drug. Well, and now we learn how the drug behaves in these patients, and I think this is really critical knowledge, and it was nice to see that many abstracts were submitted on this topic. Yeah, another challenge is that in clinical practice, antibiotics are often used in combination, and this is often not done in a rational way. Antibiotics are combined rather to match the antibacterial spectrum, but there's no real rationale to combine these antibiotics. And we have seen only few abstracts this year on antibiotic combinations, so it would be really nice to see more, because this is an important topic. I would encourage my colleagues to maybe submit a late breaker on this important topic, that we also rationalize how we combine antibiotics in the clinic.